It's a great pleasure to be here to present the study that is starting in Italy. And the study is promoted by the Italian Association of Hospital Gastroenterologists with the essential help of Dr. Shar. Okay? As I don't want to stay on this slide, what we know about gluten sensitivity or non-celiac now, starting from yesterday, non-celiac gluten sensitivity, that is okay, it's mainly a syndrome of unknown origin caused by the ingestion of gluten. Gluten sensitivity is mainly characterized, as we have seen, by GI symptoms, and they are mainly recognized as functional, these patients, as EBS-like, and is thought to have a high prevalence in the general population, higher than celiac disease, between 6 and 10%, but its real dimension is actually unknown. And actually, diagnosis is based upon the exclusion of the other disorder, or mainly the gluten-related disorder, such as wet allergy or celiac disease. What is the GLUTOX trial? It's a nationwide trial that you are conducting in Italy. And it want to enroll patients for the gastroenterology units, okay, affiliated with the AIGO, Italian Association of Hospital Gastroenterology. It is designed as a double-blind trial with a crossover, and the expectation is to enroll 1,000 patients in 16 months. And the primary endpoint, because I think this is the main point actually with gluten sensitivity, is to recognize the real incidence of the gluten sensitivity in the daily current gastroenterological practice. I think that the main problem is that we don't know so much, also because major of the people working on this issue is coming from celiac disease, and probably this is a bias because we see more of these patients than they have. So we want to make a photo of the real incidence in the daily practice of the specialist. And secondary point, of course, is to compare the GS to non-GS subject concerning all the parameters we are going to evaluate in the study. Now I'm going to explain you briefly the design of the study. We want to enroll mainly functional patients. So following the Roma-free criteria, the patients with irritable bowel syndrome, or dyspeptic patients, or all these patients that have other unspecified GI functional disorders, such as the functional diarrhea, etc. We enroll these patients, we perform a routine blood test, and the screening, of course, for celiac disease with the anti-transglutaminase antibody and AGA dosage. And of course, we want to exclude allergy, while other tests that are actually not in the guidelines, such as for celiac disease or other disorders such as genetic imaging or endoscopic tests, will be conducted if clinically indicated. So what we want to know is to set the study in a very large clinical spectrum in Italy, throughout Italy. The exclusion criteria will be, of course, the presence of allergy or celiac disease, the presence of other GI inflammatory diseases, such as, of course, the IBD, the presence of malignancy or major abdominal surgery. It means that major, I think, intestinal surgery with resection of the GI tract. Okay, enroll patient at time 0 at the beginning of the study will undergo to perform some tests such as the quality of life, the SF-36 and the SCL-90, and we want to make some evaluation of the symptoms through the VAS scales, and after that at time 0 they start a 3-week trial with a gluten-free diet. And after this 3-week long period of time, I think there is a crucial point, not only for the study, but in general, for the definition of gluten sensitivity, because we make another evaluation with VAS scale and the quality of life. And after that, we have to decide if they are probably gluten sensitive, if there is a possibility that they have, or they have not. And this is, the response is what we expect from the gluten-free diet and what we are going to call as gluten sensitive, because what we expect the 100% of response, I don't know, we are choosing that we, for the definition, to start to think if the patients could have the gluten sensitivity, we need a reduction of VAS scale and improvement of the 30%. So who does not have this improvement, they stop the trial because they think that they have not gluten sensitivity. They could have not gluten sensitivity. If the patient has this kind of improvement, they start their randomization. That it means to make a blind randomization, always following a gluten-free diet, with 5 grams of gluten per day in capsules, placebo or gluten for 7 days. After these 7 days, they perform a test for quality of life and VAS scale. After that, they make a 7 days of washout, always following a gluten-free diet. And here there is a crossover for who takes gluten and start the 7 day of placebo, and who have taken placebo start with gluten and repeat this part of the trial with 7 days of gluten or placebo, depending on what they've taken before. And after that, they newly start with the quality of life questionnaire and the VAS symptomatic scales. So this is another point is after that, what we are going to define as GS, the subject who are going to respond only to gluten with a response to gluten measured than 30%, what we are going to define as patient with gluten sensitivity. So to summarize the timeline of the study, we start with 3 weeks after the enrollment with 3 weeks of gluten-free diet. We make 7 days of gluten or placebo, 7 days of washout, and 7 days of placebo. Of course, the randomization could invert this kind of gluten and placebo. So after the study, we have 4 possibilities as the results. We could have patients who are positive for gluten and negative for placebo, and it's very easy to call them gluten sensitive. And so other patients, such as gluten, who are going to have a response to gluten and to placebo, probably they are truly functional. The problem, of course, is with the other patients, which have a gluten negative and placebo positive, or gluten negative and placebo negative, because you have to remember that they have before had a at least partial response to the gluten-free diet. So we should discuss the other kind of patients. But however, we are going to call as truly gluten sensitive these kind of patients with a gluten positive response, and of course they do not respond to the placebo. And eventually I want to thank all my collaborators that helped me to the design of the study, and of course the scientific committee, and mainly Carlo and Anna for helping us to design this study. Thank you very much.